Can everybody hear me okay? Good. So I've probably given over 1,000 talks at some of the most prestigious universities, Harvard, the Ether Dome at Mass General, Brown, UCLA, Mayo Clinic. But this is the first talk that my mom is here. So I better be on my good behavior, and you know, if it wasn't for the guidance of my mother and my father, I wouldn't have been here. Getting through medical school is a lot of hard work, and you know, one thing my father taught me is the value of hard work. And so I'm going to talk about falls today. And so every 11 seconds, somebody falls. Every 19 minutes, somebody dies from falling. And so we tend to think about falls as really not a serious problem. And I can tell you, in the geriatric world, if you want to stay out of an assisted living, if you don't want to go to a nursing home, don't fall. It is the quickest way to end up in a different living circumstance. And a typical scenario is mom falls, she can't get off the floor. The son and daughter from California move mom into an assisted living. And now they know that she's safe. So falls is just a super important topic. Let's see. For some reason, it's not changing. All right, so we should always start off with a definition. What is falls? And basically, it's coming to a rest, you know, from a standing position to a lying position. And basically, we try to distinguish syncope, which in medical terms means passing out. And we tend to handle that as a different type of situation than actually falling. And it's always important to have a definition, you know, so we know we're all talking about the same thing. And so 30 to 40% of the people living in the community will fall, and 50% over the age of 80 will fall. So falling really is a geriatric issue. Younger people tend not to fall, and if they do fall, they tend not to get hurt. If you live in a nursing home, the average resident in a nursing home falls 50%, and of those who fall, they fall multiple times within a year. And 60% of those with a history of fall will fall again. So if you've fallen once, you're more likely to fall again, and you need to do something about it. The problem with falls is there's not one etiology. There's not one thing I can tell you to do to prevent you from falling. There may be 10 things I can tell you to do. And in geriatrics, it's better to have 10 things to fix than one thing, because a lot of times a little bit of changes can make a big difference. So as we fall, you can see that falling increases with aging. So this is in people over 65 to 69, and you can see this age group here over 85. And so falling really is a geriatric topic, and the older you are, the more likely you are to die from falling. And so the real age group is at 80 years old and plus, and you could see as we, over the years, even since 2005, going up to 2014, the death rate from falls has increased, and in part it's related to the aging of the population. And so accidents is the 5th leading cause of death in older people, and falls makes up 2/3 of those accident deaths. So what happens when we fall? The main thing is we get a decline in our functional status. Our functional status is our ability to take care of ourselves, get around in the house, bathe ourselves, make breakfast, make dinner, go shopping. When we have falls, it leads to nursing home placements, and then also increased use of medical services. Our government cares about falls because it's very, very, very costly. But one of the most distressing things about falls is the fear of falling. And people who fall can actually get paralyzed by the fear of falling. And that in itself makes them more likely to fall again. Half of those who fall can't get up. And that's a very common thing. And even a younger gentleman, he was 80 years old, they were up in North Carolina, and he fell between the toilet bowl and the shower. And his wife is in her 70s, but hard of hearing. And so she couldn't hear him all night long. And so she was more distressed than he was. he said he was able to find a very comfortable spot. And so it wasn't so bad for him, but she was devastated. And so now we actually have him working with a trainer, and actually the trainer gets him every Friday, gets him on the floor, and he practices getting up. And that's something we can talk about. But if you fall and you can't get up, it's what we call a long lie. That really predicts that your function is on the way down. And so those are the people who really need to take falls seriously. So to talk about the cost of falling, 8% of the population over 70 goes to the emergency room with falls. And if I could give you one piece of advice, you don't want to go to the emergency room and you don't want to go to a hospital. So falls almost end up there. A third of the people who fall, who go to the hospital, end up getting admitted. And 5.3% of hospitalizations over the age of 65 are the result of falls. And so it costs us, they're saying in 2020, $32 billion, and they just released some statistics that actually came out 2 days ago that's saying $60 billion by 2020. And so falls is, obviously an expensive illness. And again, if you want to stay out of an assisted living, we want to work hard to try to prevent you from the fall. So the problem why falls are so frustrating to doctors is there's not a single etiology. If you get the flu, it's caused by one virus. We treat the virus and you get better. Falls, we really have to treat multiple different things to try to get it better. And this is very typical of almost everything in geriatrics. And in geriatrics, we call them syndromes, which basically means there's a lot of things that cause it. And the way I like to look at falls is this interaction between intrinsic factors, which are factors within inside us, osteoarthritis, high blood pressure, chronic diseases that we have, and then challenges to our postural system. If you knew what it took to go from lying down in bed to up in the morning, you wouldn't want to get out of bed. But you think about it, your body has to compensate for gravity. It has to get blood to your head. So the heart needs to be quicker. The arteries need to constrict. All this is happening within seconds. And as we get older, that feedback mechanism doesn't work as well. And it's one of the reasons why we get changes in blood pressure as we age. And I'll go into that in a little bit more detail. And then there's other mediating factors, situational risk-taking. I remember a call I got after Hurricane Charlie. I got called to see a lady in the emergency room who had fallen and broke her pelvis. And she was this sweet little lady, and she was 96 years old. And she's telling me the story, what happened. And so after the hurricane, there was palm fronds on the roof. So she got the ladder out. And she got up onto the roof, and she removed the palm fronds. And on her way down, she missed a step. And so she fell and ended up breaking her pelvis. And you say to yourself, what the heck was she thinking? And then the other half of me says, my God, she's 96 and she got on the roof. And so you could see both sides of it. But as you get older and you get unstable, you shouldn't put yourself in situations where you're going to have more risk. And so when we talk about intrinsic risk factors, age is one of them, right? You can't change your age. It is what it is. But we know that's an increased risk of falling. Cognitive impairment, and I'll talk a little bit about cognition, but having problems with your memory increases your risk of falling. And this is probably the hottest area of fall research right now, is how memory affects your balance. And when I gave a very similar talk in November, I didn't have any of that. It's all just coming out in the last 6 months, so it's quite fascinating. Being female is a risk factor, and it may be related to having decreased muscle mass. Obviously having a history of fall, we talked about being a big risk factor. Leg weakness, and you have leg weakness if you have to bob to get out of your chair. My patients will tell me, well, I don't have to use my arms, but to get out of that chair, they do one of these. On the count of 3, they throw themselves and they get up. And that's a dangerous situation, because if you keep on going, you're going to land on your head. And I always say, if you're going to fall, it's better to land on your head than your hip. And so if you have problems with your feet, feet really affect your balance. It's like a foundation of a house. If you have bunions, your feet hurt, all that's going to increase your risk of falling. Problems with your balance. And then vitamin D is been associated with falls, but I'll tell you that it really has been associated with falls in a long-term care setting, assisted living, nursing homes. And in the community, the recent studies have shown that it's not as strong as a risk factor it is in people who live in a nursing home. People who have pain have a higher incidence of falling. In part, the pain affects how they walk and their balance. And then Parkinson's disease. Parkinson's disease is it's a devastating disease, and it changes their posture. So somebody with Parkinson's disease, they get very flexed posture, and they walk like this, so their center of gravity is ahead of them. When we walk, our center of gravity is supposed to be over our hips. And one thing that happens as we get older, when you take a normal stride, you see my balance is here. As we get older, we lose flexibility and we take shorter strides, and look at my shoulders. So at any given time, I'm off balance. And you can say, well, just take a longer stride, but if you're forcing it, it makes it worse. And that's why flexibility becomes important as we age. So there's some age-related declines that we see that increase our risk. One of them is problems with vision, and this can be something very fixable like cataracts, or something macular degeneration, which may be harder to fix. And proprioception is our way to know where we are. And a lot of times you've probably had on the exam, your doctor makes you put your hands out and then close your eyes, and then all of a sudden you start swaying. And so when we do an exam, we take the toe and we move it up and down, and then we say, is your toe up or down? And vast majority of older people can't tell where their toe is. So now if their vision isn't good, they don't know where they are in the world. And one of the reasons why they fall. And losing proprioception is definitely associated with aging. It's associated with some diseases. Blood pressure is a big issue. 80% of people over the age of 80 is going to have systolic hypertension, the top number being high. And blood pressure drugs increase your risk of falling. And then the other thing is, as we age, we don't hold on to as much water. And so we're prone to dehydration. And it's kind of interesting. One of my mentors, up at Harvard, he did this study with Marines. He took these 18, 19-year-old Marine snipers, and he would have them shoot at their target. And then he would slowly get them dehydrated. And when they were 5% dehydrated, they no longer were as accurate. An older person doesn't know if they're dehydrated till they're 10%. And so you can see how dehydration can be a risk, and the older person not even knowing about it. Chronic diseases, we mentioned Parkinson's disease. People who have a stroke will have weakness on one side or another. And then arthritis affects how you gait, how you walk, and you may try to favor one side, which then puts your center of gravity off to a side. I'm going to talk about medication separately because it's such a big topic. So what happens as we age? We lose muscle mass, and that's something we call sarcopenia, and I'll show you a picture of what that looks like. But as we age, even if your weight is the exact same as it has been your whole life, you've probably lost anywhere between 30 and 50% of your muscle mass. And this is a normal part of aging, and we're finding some ways that we may be able to prevent this. This is one of the reasons why we encourage older people to lift weights. And we always say lift weights like Arnold Schwarzenegger, heavy weights, lower repetitions. We want muscle mass. If you want to stay out of a nursing home, you've got to make sure you're strong. When you can't get out of a chair, that's how you end up in a nursing home. And it can happen so quick. And I think of a guy who was visiting Disney in Orlando, who's 90 years old, and he had a great day with his family, and the next day came down with pneumonia and couldn't get out of bed. And it took him, 3 days in the hospital, and then 3 months of rehab to get stronger. And it came on like that. But all the years I was telling him, lift weights, lift weights, lift weights, and now he lifts weights. And he works out in the gym next to us 3 times a week, and he's trying to improve his muscle strength. So there's a reduction in the number of nerves, so it's harder to know where we are and send up the signals. And it takes longer for the nerves to go from your toes to your brain. And if you think about it, you step down, you feel something. That's got to go all the way up to your brain. And then your brain's going to say, move your foot. It's got to go all the way back down. And so if that takes a little bit longer, then our reflexes start to get impaired. And then we have exaggerated responses to blood pressure. And there's a unique phenomenon that older people get called postprandial hypertension. So when an older person eats, their blood pressure may fall 30, 40, 50 points. And so they have a big meal, and then they get up, and they get about 8 steps before they pass out. And it's because their blood pressure was so low from the meal. And this can be drastic in diseases. For example, in Parkinson's disease, there's a variety called Schreiber-Drager's, and they can get very drastic changes in their blood pressure. And I took care of somebody whose blood pressure lying down would be 220, and then standing up, his blood pressure would be 40. And it got to the point that if he tried to get out of bed, he passed out every single time. And it can be very difficult to treat, because if you leave it high, they have strokes. And so it can be an issue as we age. And it's one of the reasons why so many people pass out. When I give a talk about syncope or passing out, I always show a slide of the Bushes. You know, President Bush Sr., passed out in Tokyo when he threw up, and then his son, when he choked on a pretzel, passed out. And so, our bodies can have these exaggerated responses. And so this is a thigh muscle. Does the cursor show up there? Yeah. And so the yellow is muscle, and the red is fat. So if you look at the young versus the elderly, they have the same size thigh. But if you notice the amount of muscle mass in the older person, it's gone. And even look at the quadricep, which is what you need to get out in this older person. Look how small it is. And then I'll just point out the thinness of the bone, which is obviously osteoporosis. And so this person may not know that they're losing muscle mass. And this is just a normal process, as we call it, sarcopenia. So this is a nerve cell. And I always say, you want your nerves to look like our trees did before Hurricane Irma, right? After Hurricane Irma, we look like this. And so you see all these branches, and these are all connections to other nerves. And this is how our signals go. This is a normal, healthy, older person, but look, the signals are gone. And this is one of the reasons why the reflexes get impaired, why proprioception gets impaired with older people. So when we talk about this disease-related factors, cataracts, things that affect our perceptions, anybody who has cataracts and the eye doctor tells you should have them taken out, you should have them taken out. The other thing is if you have cataracts, don't paint your house. Cataracts happen so slowly that you don't even know it, and then all of a sudden you get your cataracts removed and you can't believe the color you picked out. Hearing loss is a very hot topic in aging. And so years ago I would tell my patients, oh, just wait, you're not going to wear them. And what we find out is, what's the typical story? Why don't I wear my hearing aids? Well, they don't work. Right? You hear that all the time. And the reason why they don't work is that person waited too long. And what we found is the average patient waits about 6 years before they get hearing aids. And the part of the brain that controls hearing atrophies. And so it's actually a brain issue. It's your brain not working, not the hearing aids. And so if you're having problems with your hearing, you want to get the hearing aids early. We also know that atrophy in the brain from the hearing loss increases your risk of Alzheimer's disease. So if your TV is getting louder, people are complaining, go get your hearing checked. Peripheral neuropathy, affects your ability to feel where your feet are. So these people tend to walk louder because they don't feel themselves stepping the ground. And then vestibular disease is common with older people. Probably a third of the people here have had benign positional vertigo. You get out of bed and everything starts spinning. And obviously if you're having vertigo, it increases your chance of falling. So then orthopedic issues such as arthritis, some people have injuries, especially the World War II generation. And then spinal stenosis is common in older people. And it's unique because the spine, the bone starts to grow in on the spinal cord, and it causes the legs to be weak. And the person realizes in order to make their legs stronger, all they have to do is lean forward. And so you'll see these people walking like this, and they don't have Parkinson's. And if they stand up, the wife always tells them, stand up straight. They stand up straight, now their legs are weak. And what happens is their center of gravity is so out in front of them that they start walking and they, you know, it's like going down a hill. They can't keep up and they ultimately fall. And this is fixable by removing the spinal stenosis. Cardiovascular arrhythmias, atrial fibrillation, heart blocks all increase your risk of falling. And then valvular disease, in particular aortic stenosis, which is a narrowing of the aortic valve, which is common as we get older. And it prevents the blood from getting to the rest of your body. It used to be a pretty big surgery, and now we could actually fix them through the groin with pretty good outcomes with a catheter and overnight stay in the hospital. We can't do that for mitral valves yet, but we can do it for aortic valves. We talked about blood pressure issues, and then your carotid artery is kind of your receptor where your blood pressure is, and it kind of sends the signals to your brain and everywhere else about what to do with your blood pressure. And our carotid sinus doesn't work as well as we get older. People who have had strokes, and then myopathy is just a medical term for muscle weakness, and that's common with aging, and it could be sarcopenia of aging, the muscle loss we get of aging, or it may be a result of a nerve problem, you know, or a underlying myopathy. And then Alzheimer's disease, they fall for a variety of different reasons. People think of Alzheimer's disease as a disease of memory, and it is, but it's so much more than that. It affects their mood, it affects their ability to coordinate, and they tend to be a lot higher incidence of falling. So drugs and alcohol, you know, are a big way. Anybody who's on a water pill, it makes you rush to go to the bathroom. And one thing that you should know is if you're 75 or so, you probably shouldn't be rushing to do anything. You should be taking your time. That's a recipe to fall. Blood pressure pills, we got to treat your blood pressure, but they're independent risk factors for falling. And sedatives, you know, if I could roll back time, I would make it so that sleeping pills were never invented. Sleeping pills become a crutch. Your mother and your father taught you how to sleep, and then somewhere along the way we lose it. I will admit that it's harder to sleep as you get older, but the sleeping pills are just really bad for them. The over-the-counter ones are even worse than the prescription ones. And then I'll talk a little bit about the anticholinergic medicines. These are, you know, the medicines that we give to improve memory and Alzheimer's disease are cholinergic. And so anticholinergic are meds that affect the brain in a negative way. And so the classic example would be Benadryl, which is in Tylenol PM, Advil PM. You know, Benadryl is a common